Hello, everyone. Welcome back to another CT Registry review lesson. This is Physics Part 3. In today's lesson, we're going to talk about image quality, how to get the best picture. A lot of you all are finding these videos helpful. If you would like a Part 4, could you please give the video a thumbs up or just comment and let me know if you would like another review. Um, and let me know like what are your weaknesses whenever it comes to your radiology CT test. Is it the physics? Is it sectional anatomy? Is it patient care? Let me know what your weaknesses are so that I can know if I need to make new lessons around those. So for this lesson, we are going to talk about image quality, spatial resolution, contrast resolution, and temporal resolution. And you see that I have the orange arrows pointing to image production. That is the section that we are covering right now whenever I go over physics. And you see it will be about 50 questions about physics related material, which is a lot because for procedures you have 71. So just keep in mind I would say just know everything about the test, but also know if your weaknesses are sectional anatomy or physics, you need to spend a lot of time focusing on those as well. So we'll get started. So what I like to do is I like to read the material out loud because a lot of people watch my videos in the background. So you will hear me just read this information just so that if you are washing dishes, if you're exercising, if you're cleaning up real quickly, you can just play me in the background. If my voice or the audio bothers you, you can always just turn it down or mute it and read the slides like that. So now we'll talk about spatial resolution. In CT, spatial resolution is the ability to differentiate between closely spaced structures or objects. So as you can see on this picture, you can see one picture, you cannot really see the details as well going with the temporal, with the ear. But as you look over, you can see that you see more of the ear, the inner canal area better. So the things that affect spatial resolution in CT will be your focal spot size, your detector size, reconstruction algorithms, your field of view, your reconstruction kernels, slice thickness, pitch, magnification, and patient motion. Just remember, whenever you increase or have a higher spatial resolution, this equals a more accurate and detailed image. So that's what we want. We want something with a higher spatial resolution if you're looking for more detail. Factors affecting spatial resolution, you have your focal spot size, which is a smaller focal spot size, which will lead to a better spatial resolution because it concentrates the X-ray beam and reduces blurring. You have your detector size. A smaller detector element size will allow for more precise detection of X-ray signals, which improves spatial resolution. You have your reconstruction kernels. This is used to create the CT image and can affect spatial resolution, which also has edge enhancing kernels that can improve the appearance edges but may increase noise, which impacts the contrast resolution. Also, you have your field of view affecting the spatial resolution. A larger field of view results in a decreased spatial resolution since it requires a larger pixel size. Slice thickness. Thinner slices provide a better spatial resolution since it has the ability to capture more detailed information from a smaller volume. So sometimes whenever I do work as a CT tech, the radiologist may call and say, hey, I've gotten these images. Could you add thinner slices? Could you change the slice thickness? So normally whenever you are scanning an abdomen, the slice thickness is at like 5. But sometimes, let's say a radiology call you and say, can you change those to 3? So you'll just change them. And then you have your pitch. A lower pitch results in better spatial resolution. It will make for more accurate data collection. The distance the table moves during the scanning is which is what pitch is. So pitch is the distance the table moves during scanning. Magnification, this increases the magnification, which will reduce spatial resolution. So just know whenever magnification increases, spatial resolution reduces or decreases. Patient motion. Any movement during the CT scan has the ability to cause blurriness on the image and reduce spatial resolution. So if you're scanning the temporal bones, kind of like the image that I showed you in the previous slides, we all know that the temporal bones is like very fine detail areas that we really need good pictures of. So if a patient cannot hold very still, there will cause blurriness on the images, so we won't get clear images of the temporal lobe. In the last slide, I meant to say temporal bone, not temporal lobe. But why is spatial resolution important? We'll talk about it in this slide. It improves diagnostic accuracy. A higher spatial resolution allows for a better visualization of small anatomical structures, abnormalities. This also aids in proper diagnosis that the radiologist will be making. It also has precise measurement and characterization. Detailed images produce accurate measurements of lesions, which is very important for treatment and surgical options and outcomes for patients. You also have enhanced visualization of intricate structures. Higher spatial resolution is very beneficial and important for the temporal lobes, bones, lung nodules, and in-stent stenosis. And then this is an image, of course, of your lungs. Now we have contrast resolution. Contrast resolution is the ability to distinguish between objects with differences in tissue densities. Contrast resolution is the measure of how well a CT scan is able to distinguish between those objects with similar densities. High contrast resolution refers to the ability to distinguish between objects with very different CT values, like your bone and your air, while low contrast resolution refers to the ability to distinguish between objects with slightly different CT values, like soft tissues. And then you have your image where you see one image is without contrast, and then you see the other image with contrast. So now you can see those abnormalities, those lesions better because we're using contrast, hence contrast resolution. Factors influencing contrast resolution, you have your patient factors, natural tissue densities, as well as any pathologies that alter those densities, which impact contrast. You have contrast agents. IV or oral contrast can enhance contrast by increasing the attenuation of blood vessels or other specific structures in our bodies. So if you work at a clinic where or hospital where you have to give your patients oral contrast, let me know in the comment box if you don't have to or if you do. Normally you do. So a lot of times hospitals will have patients come in like the day before and pick up bottles of contrast. So you may not have to pass out the contrast bottles, but when if you do have to pass out contrast, do you know the wording that you're supposed to tell patients? Are you comfortable with telling patients the time frame? So ideally, whenever I have to hand patients or contracts to drink, sometimes they do pick it up the night before. If you work at an imaging company or a clinic, sometimes the front desk people, they hand them the contrast and the patient drink it in the lobby, or they may sit in their car and drink it. But whenever I hand patients contrast to drink, I tell them try to drink the contrast bottles as fast as you can without getting sick. Because if you do not tell them these instructions, then they are going to sip on the contrast for about an hour to 3 hours. Keep in mind, sometimes whenever people come in for these scans, sometimes they take off from work. So they're looking at like, I have all day to drink this. They may not like the taste. So you have to let them know if you don't drink it fast, then it's not going to give a good study because it's like a time limit. after they drink the contrast, they may have to wait an hour or so before you can scan them. So just keep that in mind whenever you do have to hand the patient oral contrast. And then you also have technical factors. You have your X-ray tube voltage, your tube current, detector size, reconstruction algorithms, and image noise that can influence contrast resolution. You also have image display, windowing, your windowing level, and your windowing width. This can affect how the contrast is perceived. So, for example, if you are looking at an abdomen or a chest, and whenever you are looking at it, you can't see the organs and the body tissue well. So, you're taking your mouse kind of like this, you're taking your mouse and your cursor and you're either holding down one button and you're moving your mouse on your desk to get a better picture. So that's window and leveling whenever you're taking your mouse and you're dragging that cursor around the image to try to see, should I make this brighter? Should I make this darker? Can I see this better? So I know whenever I do or perform CT biopsies, a lot of times I do have to window and level for the radiology so that they can see the needle and make sure that the needle is where the tumor is at or close to the tumor, making sure that they are in the right area. Also, put in the comment box if you are comfortable with performing biopsies. I do have a video in my CT Registry review playlist if you want to check that out. Why is contrast resolution important? Contrast resolution is crucial for detecting pathology such as tumors, lesions, or other abnormalities. High contrast resolution can help identify changes in tissue properties that may have toxic being present. The importance of contrast resolution, you have your cardiovascular imaging. This is going to help identify coronary artery stenosis and plaque, neurological imaging to rule out strokes or other brain or head abnormalities, ab- abdominal imaging, distinguishing between different organs and tissues for identification of abnormalities. So you also have that contrast was given for this patient. You can see something is going on in this picture where it's highlighted. So just keep in mind if we didn't have contrast or if the patient wasn't given contrast, would you have been able to see this clearly? You probably could have seen like a little bit of it, a shadow of it, but would this have been this detailed if contrast was not given? Okay, now we're going to talk about how to improve contrast resolution. You want to make sure that you are choosing an appropriate window in. So optimize your window level and window width to enhance the visibility of specific tissues and structures. You also have use contrast media, which is going to be per doctor's request or patient's condition. Sometimes even a radiologist may recommend contrast to be used. This is going to enhance the contrast of blood vessels or other structures that can improve the ability to visualize them. So whenever I say this is going to be per doctor's request or patient's condition or the radiologist may recommend it, is because sometimes whenever, let's say, a scan get ordered, sometimes it can get ordered incorrectly, or a lot of times because I work in different modalities, so I'm going to use MRI as an example. So sometimes when I work in MRI, the order may come over from the doctor's office without contrast, but the radiologist may say, I recommend that they order this scan with contrast. So that's why I said, or the radiologist request. Optimize scan parameters. You want to adjust your scan parameters like the tube voltage, tube current, and reconstruction algorithms that can improve the contrast. Whenever I am doing a CT PE exam or a CTA of the abdomen, sometimes depending on the patient's body habitus, it is a little difficult to see, let's say, where I'm trying to smart prep. Sometimes I do have to go up on the mask just a little bit to get a better image of where I'm at in the patient's abdomen or chest with my ROI. So whenever you are changing the the parameters like this, if you are going out of range for the patient's body that you are scanning, it will probably make you put in a note of why you're increasing, let's say the KVP or the mass. A lot of times I see this on mass. So whenever you increase the mass or you're going up a little bit too much, it's going to have you put in a reason for it. Sometimes you can just get away with putting in body habitus. You also want to reduce image noise, increase the tube current, or use appropriate reconstruction algorithms to reduce the image noise. Temporal resolution. Now we're talking about this. Temporal resolution is pretty much how fast the scanner can capture the images quickly. It's the scanner's ability to obtain images in succession, affecting the ability to free fast moving objects like the heart. Better temporal resolution equals clearer images, especially when dealing with motion artifacts. It's especially good in cardiac imaging. Is very good for someone who you know cannot hold still. So if you have a patient who is altered or who is just nervous about the exam, some patients get CT and MRI scanners confused. So maybe they're just have anxiety about, is this an MRI? And you keep telling them, no, it's a CT scan. Sometimes they're still nervous because it look very similar to them, especially if you don't work in imaging. So it's good for people who cannot hold still, who probably will move. This is what the temporal resolution is good for. And in cardiac CT, it relies on high temporal resolution to capture images during these specific phases of cardiac cycle. You have poor temporal resolution. This can lead to motion artifacts, blurring, and difficulty with visualizing structures like calcified plaques in the coronary artery. So, what scanner slice do you work on? I'm interested or curious to know. Um, I've worked on as high as a 512 slice CT scanner. It is excellent for cardiac studies. I'm not sure if you all know your slice. Let me know if you worked on a 512. Let me know as well. A lot of people, I've been seeing like a lot of people use either 64 slice or 128 slice, but I've used a 512 slice. That's the highest I've used. I'm not sure if there's anything higher than this. I have not heard, unless it's like for research purposes. What affects temporal resolution? Your gantry rotation time, which is the time it takes for the CT gantry to complete one rotation. Your pitch factor, the amount the gantry moves along the patient's axis during a rotation. Collimation width, the width of the X-ray beam. Acquisition technique, perspective triggering, where scans are initiated based on the patient's ECG. So some ways to improve your temporal resolution, we have the dual source CT, which is faster temporal resolution, is offered for more detailed visualization of moving structures. You also have your hardware and software advancements. This is improvements in the scanner technology such as faster rotation speeds and advanced reconstruction algorithms. You also have multi-cycle reconstruction. This is the techniques that capture multiple cardiac cycles during a single scan, allowing for better analysis of dynamic processes. All right, so that's it for this lesson. If you want a part four, please give the video a thumbs up. If you're trying to get to my CT registry review videos faster, click on my CT registry / CQR review playlist, because a lot of times I do add in days in my life videos. I add in things about mammography, x-ray, because my channel is like pretty much all about radiology in the areas that I work in. Sometimes I do throw in lifestyle content and vlogs or just chit chat videos outside of radiology. whenever I'm taking a break or whenever I'm working or whenever I'm in school and can't put together these presentations. That's why thumbing up the video or comment and let me know that you found it helpful is like much appreciated, because it just encourages and motivates me to just keep making these videos for you all, which is time consuming, but I do enjoy making them. But other than that, if you found this video to be helpful, please give it a thumbs up. If you want to, you can hit the subscribe button. And other than that, let me know if you would like another review lesson. All right, bye.